Hello everyone and welcome back to my channel. I hope you've had an amazing week. This is GP Made Easy and I'm Dr. Daniel Follows. So today I'll be covering irritable bowel syndrome, or IBS as it's more commonly known, as it is a very common condition and it can be quite tricky to manage, but there's also lots of different treatment regimes. So I'm hoping by the end of this video you'll have a better understanding. But before we go ahead, don't forget to like, comment and subscribe so I know that you're enjoying this content. Anyway, on with the video! First of all, a little bit of background information. IBS is defined as a chronic, relapsing and often debilitating disorder of the gut-brain interaction. The pathophysiology of it is not fully understood, but it is likely to be multifactorial. Some of the possible mechanisms for it include visceral hypersensitivity, so where your organs are a bit more hypersensitive, and abnormal gastrointestinal immune function, changes in the gut microbiome, so the bacteria that live in your gut have all changed, abnormal immune activity, abnormal central pain processing of afferent gut signals, so abnormal gut-brain interaction. So this is where your gut sends off signals, but for some reason your body's interpreting it as pain. And abnormal gastrointestinal motility, so the bowel isn't pushing things along or moving along as it should be. Now, IBS is classified mainly by the predominant stool type you have. So IBS-D, so where you have mostly loose stools. There's IBS-C, where you're more constipated. Or there's IBS-M, where there's a bit of a mixed picture and it goes up and down. So, a little bit more information. It affects about 5 to 20% of the population, and it's found to be more common in 20 to 39-year-olds. Possible risk factors include a recent enteric/bowel infection. There may be a genetic link, maybe secondary to gastrointestinal inflammation. So for example, patients who have inflammatory bowel syndrome can go on to develop IBS. Certain foods can cause it. Also certain medications, for example, certain antibiotics can affect your bowel. Or if you have a psychological comorbidity, so for example, people with stress or anxiety or depression can go on to develop IBS as well. Moving on to diagnosis and symptoms. So, IBS is diagnosed as a 6-month or greater history of abdominal pain/discomfort that is either relieved with defecation or associated with altered bowel frequency or stool form, and you must also have any 2 or more of the following: altered stool passing, for example either increased urgency or straining more, or feeling like you've not fully emptied yourself after the toilet, abdominal bloating or tension or distension or hardness, symptoms made worse by eating, or passage of mucus. Other symptoms associated with IBS include fatigue or lethargy, nausea, backache, or bladder symptoms. Now don't forget, when assessing any patient with suspected IBS, to rule out any alarm symptoms such as weight loss, rectal bleeding, if they're 60 or above with a new change in bowel habit, if they have a new iron deficiency anemia, if there is persistent or frequent bloating in a female patient, especially if they're over 50, if you find an abdominal or rectal mass on examination, or if there is a strong family history of bowel, ovarian cancers, or even a strong family history of inflammatory bowel disease. On to investigations. So IBS is a diagnosis of exclusion once we've ruled out all other differentials. So first we start off with bloods. So you get a full blood count, you get a CRP or ESR, you only need one and not both of them. You get a liver function test and a thyroid function test and a celiac screen. Now, to make you aware, for the celiac screen to be valid, the patient needs to have at least one meal containing gluten for 6 weeks prior to having the test done. If you think there may be an infective cause, you can get a stool culture arranged. If you have a woman with the frequent or persistent bloating, as mentioned earlier, you can get a CA125 done. And if you've got someone you're worried about bowel cancer, you get a FIT test organised. And if you suspect inflammatory bowel disease, you can get a fecal calprotectin arranged. Now, if the bloods come back and someone has like a low hemoglobin or raised inflammatory markers, then these are the ones that you'd need to have another think about and think if any further investigations need doing. Now, moving on to management. So first line is diet and lifestyle. So it's recommended for them to increase their physical activity, that they should decrease the amount of caffeinated and fizzy drinks that they have. And NICE also recommends them to try and get oats and linseed into their diet. It is also advised to avoid sorbitol and resistant starches, and these are most commonly found in processed foods. So if someone's not responded to diet or lifestyle, then next we move on to medications. So if someone is mainly constipated, then we'd move on to laxatives, and you just find the right combination for the patient. Now, out of all of them, it's recommended not to give lactulose. And if they've used all different types of laxatives and none have worked, then you can move on to using linaclotide. For patients who mainly suffer with loose stools, then you would give them loperamide. And then for pain and bloating associated with IBS, you could try peppermint oil, which is over the counter, or you can try antispasmodic medications. So an over-the-counter one that they can get is Buscopan. I've got it just up there. Or we have one on prescription called Mebevrin. And something that I actually realised recently is that I used to prescribe just the instant release tablets, but in the national formulary, it's actually recommended to give the modified release tablets for IBS now. So have a look on the BNF for yourselves to double confirm. And then if they've failed, next would move on to trialling an antidepressant. And the certain one that's been recommended is the tricyclic antidepressant amitriptyline. Other non-medication therapies that can be tried include cognitive behavioural therapy, hypnotherapy, and trialling certain food avoidances. So for example, there's the low FODMAP diet, but it's actually recommended that this is done under dietitian supervision. NICE does not recommend using aloe vera, acupuncture, or reflexology. And if all the above have failed, then we'd refer them to see a specialist. Something I've also found out while doing research for this topic is that there is a national charity called the IBS Network, which provides more information on IBS and also can signpost you to any local support groups in your area. And I'll link it in the description for this video. Well, that's it for today's video. I hope you found it helpful and learned some new strategies for IBS. I'll put all the resources I've used in the description below, so have a look for yourselves. Don't forget to like, comment and subscribe so I know that you're enjoying this content. And if there are any topics you'd like me to cover in future, then please comment down below and I'll pick them up. I'm also on Instagram, so if you want to check me out on there, it's up here and it's the same name, it's GP Made Easy. Or if you'd prefer, you can contact me via email and it's just up here. Well, I hope you guys have an amazing week and I will see you in the next video.